Also in Nigeria, insurgency in the northeast has affected millions over more than a decade. But the ongoing food crisis in the country has exacerbated this threat. Our correspondent Ajik Mangut sat down with the country's representative for the World Food Program to discuss the impact of this situation on local humanitarian efforts. Let's take a look.
The WFP has been at the heart of the humanitarian response to millions of people impacted by the insurgency in the Northeast. What has been the challenges that you've seen and faced in responding to this humanitarian crisis?
It's a real challenge. Security situation, which is a threat not only to the people of Nigeria primarily and the people of Borno, Adamawa, and Yobe states, but also to humanitarian workers who are really concerned, increasingly concerned with the insecurity in the region.
And you talk about the food crisis Nigeria is currently facing. How much of an impact is that having, especially on people that are affected by the insurgency in Northeast?
Well, the numbers of food insecure, critical level of food insecurity have increased. Last year in Northeast Nigeria, we had about 4 million in critical need of food assistance at this time. That number's gone up to about 4.8 million. And then the northwest of the country, where there is also conflict-related insecurity, not so much related to Boko Haram and ISWAP, but there are jihadist elements coming in from further north in the Sahel, and there's a traditional farmer-herder conflict for resources, which is partly exacerbated by climate change, which is another effect on food production. But the core is conflict, and I added to that the food inflation. And the numbers in the northwest have gone up from 4 million in critical need of food assistance 6 months ago to 6.5 million now in critical need of food assistance. And the malnutrition rates, malnourished children, are 4 million across the region. So that is a tremendously high number of children that are malnourished, 800,000 of which are at critical risk of falling into the most critical stage of malnutrition.